How does the MSL gather insights? I know you've probably heard a lot about insights, but what does an insight actually consist of? How does an MSL gather the insight and what do they bring back to the company? You will definitely see this described in the job description, and you could be potentially asked this in the job interview. So let's dive into exactly what an insight is and how to gather them. When gathering insights, you're typically going to be listening around certain priorities. These are called listening priorities. Typically, a medical director or medical affairs leader will have certain listening priorities around certain data. For example, you could have listening priorities around safety and efficacy that was presented at a recent conference. This could be around the data that you need to collect the insights on. Then, based on your conversations that you had with your HEP, you could then go reactively have a conversation with an HEP based on their needs. If an HEP has asked you to come back and discuss pivotal data with them, then that is your cue to go back reactively and have a conversation with them. When you're having this conversation with the HEP, you really want to understand their needs and their desires and their wants and what the true gaps are. This is how you're going to gather insights. When I'm thinking about gathering an insight, I'm going to start at a very high level question, such as something about what are your general impressions about the data presented at X conference? Based on their answer is then what I call you do is the 7-layer dip approach. Based on how they answer, then you could probe a little bit more to understand their needs. So let's say, for example, when you ask them about their general impressions, they said, the efficacy is good, but the safety is a little concerning. This is your cue to then 7-layer dip approach it or probe more around safety. So some of the additional safety questions you could ask to gather more insights and probe a little bit more are really around the following questions. You could ask something along the lines like, when you're looking at the safety data, what concerns you the most? How does the AEs impact your clinical practice? Do your patients have similar concerns when starting a new therapy? Have you had similar concerns with other new therapies? What additional data do you think could be the most impactful to address your concerns? And then finally, you could dig a little bit more and ask, would a publication or education help close this clinical data gap? When you're asking these questions to the HCP, the goal of the MSL is to actively listen so you can understand their concerns and their needs. Typically, after a conversation with an HEP, an MSL will go back to the company and report the insight. This will happen sometimes either through some kind of system or it could be manual where you're just collecting them in, let's say, an Excel or PowerPoint. But either way, you will report back the insight, so then these can be used for medical affairs strategies. So, what would you actually report back as an MSL? Based on what you heard, you could report back something like this. The HCP said they were impressed with the clinical efficacy from X data, but they did have some safety concerns. They mentioned the hematological toxicities are concerning to them. These AEs impact their clinical practice because as a patient, they don't feel these AEs and they don't know what's happening, so it concerns not only HCP, but also the patient. They can also say, I've had similar problems with other therapies, so I would need some more data. A full safety data publication and monitoring would be helpful for more clinical information. Now that you've put this insight in, how are the insights used to help shape medical affairs strategies? A medical director or another medical affairs representative will often look at these insights. If they see one insight around safety, it's probably not a huge concern. But if they start to see multiple insights around safety and saying the same thing, it's probably a trigger that they would like to do something about it. Some of the potential solutions that they could do is they could have a potential publication idea around safety and AE management to address some of the HEP concerns. Gathering insights is a core skill of an MSL. Now that I've walked you through how to gather an insight, you're probably wondering, how does this have to do with me being a new MSL? This is exactly what I want to walk you through. I want to show you that you can demonstrate in a job interview and even on your resume that as a new MSL, even without experience, that you have the skill of gathering insights. Have you ever had a job where you've had to ask multiple questions or probe multiple times in order to understand the customer needs or wants? If you have, then you have MSL experience and you have gathered insights. Some of the jobs where I can think of where you've had to gather insights and ask multiple questions is really any service job. If you've done any type of customer-facing job, such as working in a restaurant, a retail facility, or even a nursing home, then you have had to interact with people to ask questions to understand their needs and their wants. You could have even also worked in a pharmacy or a hospital or even as a bench scientist. If you've ever worked in a customer-facing role where you've had to understand the needs and the wants of somebody, then you have gathered insights. Let's pull this all together. If you've ever had a client-facing job where you've had to understand the customer's wants and needs, then you have gathered insights. And boom, you have MSL experience. Now, all you need to do with the rest of the job descriptions of the MSL is take all of your skills, your past jobs, and relate them into MSL experience. Go land your dream career as an MSL. Follow me for more information at CaseyStinson.com.